Hi, I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. I'm going to talk today a little bit about clavicle fractures. So your clavicle is also known as your collarbone. And you have two of them, one on your right side and one on your left side. And they're very commonly fractured or broken, especially from cycling injuries. So if you're riding your bike and you go over the handlebars and you land on your shoulder, you're probably going to break your clavicle or sustain a clavicle fracture. So here is a patient of mine with a history of a clavicle fracture. I'm just going to pan into this x-ray. This is the collarbone right here. Here is the break. This should actually be connected to here. And here's the rest of the length of the collarbone. So this patient sustained what we call a mid-shaft clavicle fracture because it's in the middle of the collarbone. This is the beginning of the collarbone and this is the end of the collarbone, also known as the clavicle. I'm now going to show you an image of what it looked like after I fixed that collarbone fracture or clavicle fracture. So the clavicle fractures are fixed as an outpatient procedure. It's a surgical procedure. And we're going to pan in on this x-ray. This is what that exact same collarbone looked like after I fixed the fracture. So she now has a plate with multiple screws that is holding the bones in position. And if you remember before, you could see one end of the collarbone sticking up and the other one was displaced, and now it's back together. So this is what a clavicle plate looks like. Here is an example of a MyTech clavicle plate, actually made by a company called Synthes. And so the plate will fit over the clavicle like this. And then what we do as orthopedic surgeons is we will actually use a drill that's connected to a drill bit that's connected to a drill. We drill down through the hole like this and go through the collarbone. And then the next step is we actually measure the length of the drill hole by something called a depth gauge. So we put this down in here, measure the length of the screw that we're going to be using. There is numbers on this depth gauge, so it allows you to know how long the screw is that you actually need to use. And then they have a bone screw that looks like a regular screw that you'd get at Home Depot that goes down into the plate, and we just screw it into position. So the screws actually come in multiple lengths. So this is a 12 millimeter screw, which is a very common length screw that we use when we're fixing clavicle fractures. So that's how you get your clavicle fracture fixed. Once you have your plate on, there's no more movement of the fractured pieces, so it just really doesn't hurt that much. You are left with a scar that is typically as long as the plate because we have to get the plate in there and be able to put the screws in. So there is a long scar. They're typically closed very cosmetically, so you're left with a very thin scar that's present. We usually start range of motion very quickly after an ORIF or open reduction internal fixation of a clavicle fracture. We let people kind of get back on their bikes pretty quickly, usually within 3 to 6 weeks. And then allow full range of motion of the shoulder right off the bat. Now, on occasion, if you have a very thin person, the plate bothers them. And we do have to come back in possibly a year later and remove the screws and the plate. Thank you.